going to help us move more quickly to vaccinating our teachers, school employees, and frontline essential workers. As a part of our commitment to our communities, we want to support getting our teachers back to work and our children back in school. So far, we vaccinated more than 500 school system employees who met the current criteria of being over 65. And that work was through our partnerships with the Charlotte, Mecklenburg, and Winston-Salem Forsyth County school systems. And I also know that Dr. Jerome Williams has some additional details to share about our weekend events. So I'll turn it over to Dr. Williams.
Thank you, Nikki, and thank you all for being here, and special thanks to Superintendent Winston for joining us today. We're extremely excited to partner with the Hornets Inspection Center to vaccinate members of our community in the heart of Uptown Charlotte this weekend, central to mass transit hubs. At this event, we're planning on vaccinating 2,200 more of our community members, including teachers and staff of CMS. We've already received questions about how we're able to vaccinate teachers and staff if Group 3 doesn't become eligible until next week. I want to be clear, we've partnered with CMS to help vaccinate their teachers and staff who are 65 plus, and to do that ahead of school restarting next week. For other appointment slots, we're working with our community partners like churches to fill appointments to ensure equitable opportunity for those in some of our more vulnerable communities. Novant Health patients who are eligible also had an opportunity to make appointments or get moved up from the wait list. Remember, we have a limited time in which we must administer these vaccinations per the state's allocation requirements. And we only find out how many additional doses we have about a week before they need to be exhausted. It's also important to remember that we continue to vaccinate our eligible community members throughout the week, whether it be at community pop-up events or through our established vaccination sites. This event is not the only opportunity to get vaccinated. This weekend, in addition to the Spectrum Center, we'll continue our community pop-up events at Friendship Missionary Baptist Church in Charlotte, the J.F. Hurley YMCA in Salisbury, and Union Baptist Church in Winston-Salem. That's all I have to report for the community.
Superintendent Winston, do you have any comments you'd like to share?
Yes, thank you, Ms. Williams. Thank you, Dr. Williams. We certainly appreciate your partnership with the Charlotte Mecklenburg schools. And I will tell you all that Novant Health is a great community partner. That partnership is important because it's an opportunity for us to help Novant Health provide access to the vaccine in underserved parts of our local community by having clinics and at our facilities, at facilities such as Spectrum Center. We make it a lot easier for those in those parts of the community to get vaccinated. And I'm just excited that we're working together to help reduce the gaps that have become evident among parts of the population, notably our Black and Brown families. And so our partnership has enabled us some of our vulnerable staff members to get access to the vaccine. And we're just, as I mentioned, very pleased that our partners at Novant Health have also offered our staff members, as Dr. Williams alluded to a few moments ago, our staff members 65 and over the opportunity to secure appointments. As you all know, the Spectrum Center is centrally located in an area that's accessible for many by public transportation. So that really does help improve the access that I know is top of mind for so many of us. I'm also proud for CMS to collaborate with Novant Health at that clinic, both to help many of our staff members get the vaccine, but also to help others in our community get vaccinated. The last thing that I would lift up is that this pandemic is really a community challenge. And I believe the more of our community members who get vaccinated, the more immunity we begin to build here. And that will be big. That'll be a big factor, I know, in Charlotte Mecklenburg schools and in other districts, being able to return to a more normal mode of operation. So again, just want to thank Dr. Williams and the many others at Novant Health for working together with us to help with this important step toward getting beyond the pandemic.
Thank you very much, Superintendent. We'll transition to questions now, and the first question is from Tina Terry with WSOC.
Hey there, thank you guys so much for taking my question. I wanted to inquire about the Spectrum Center event tomorrow. Can you give us a numerical or percentage breakdown of the number of CMS teachers, Novant Health patients, and community heroes who will be vaccinated? We know there are 2,200 shots or so. Can you explain a breakdown of how many will go to each of those groups? Thank you.
Sure, Jerome, I'll take a stab at that. So that's a great question. How many teachers and staff have appointments tomorrow at Spectrum? And really, we're not able to pinpoint the exact number there, but we can say that there were an adequate number of available appointments to ensure that all CMS staff who currently qualify, so those that are over 65, have had ability to schedule an appointment. Keeping in mind, some CMS teachers and staff may have already gotten their vaccine elsewhere. There are approximately 1,500 staff in that group too, and Novant Health has provided more than that number of appointments to CMS. So we want to make clear that anyone who hasn't already been vaccinated and wants to be will have had an opportunity to be there tomorrow.
And can you guys talk a little bit about transportation tomorrow to the Spectrum Center event? Do you believe the majority of people who arrive will be driving? Will they be riding buses? Will they be coming on foot? Anyone that can speak to that, that would be great.
That's a great question. I don't have an answer to what we expect, but what we are doing is being prepared for all of those modes. We're right by the light rail, in addition to the bus stops that are very close, and we've secured the City Park Green parking garage. So as people who are in cars pull up, they'll have the ability to drop off a loved one if that's needed. We'll also have volunteers in that parking garage with wheelchairs to help people, get across the street and get into the Spectrum Center safely. Jerome, I don't know if you have anything to add to that.
The only thing I would add, thank you, Nikki, is that, we've partnered with our CATS partners, and they've arranged for individuals to have no requirement for paying fares to the Spectrum Center for this particular event. That's about as much detail I have at this point in time.
Thank you both. Next question is from Caroline with WBTV.
Hi, my question is for Superintendent Winston. Just wanted to ask you, how appreciative you are for them to offer this to teachers. I know that a lot of teachers had the opportunity to sign up through Mecklenburg County this morning, but because of such a high demand, a lot of them have not been able to get appointments. Can you kind of touch on that, and then how opportunities like this through Novant kind of help with that?
It certainly helps if I'm not on mute, right? Yes, I want to reiterate my comments from earlier that we're just super excited about the partnership that we have with Novant Health. And certainly that partnership did not just begin during the pandemic. It has been ongoing, but we're especially proud of the opportunity to partner with Novant on this particular matter, as we know that it certainly does impact our employees, our student-facing employees, in terms of prioritizing them for the vaccine, but it really impacts our entire community. I talked earlier about helping to reduce that gap that has become evident in parts of our community, notably among our Black and Brown families. And so I commend Novant for its leadership in this area, and we're just extremely excited to continue this partnership. I do want to lift up that we will be having a CMS media briefing in less than an hour, and so we can talk more in detail about CMS efforts and in terms of employees. But I certainly did not want to take away from what Novant is providing today in terms of this forum.
The next question is from Richard Craver with the Winston-Salem Journal.
Yes, this is Richard Craver with the Winston-Salem Journal. I was going to ask a couple of questions. One, obviously this week, especially in Forsyth County, you've seen another uptick in the number of deaths, even as we're seeing a decrease in the hospitalizations. I was trying to get a sense if y'all are seeing any patterns besides just the lag time between somebody getting COVID, somebody going to hospital, and somebody dying. And then the second question is basically, are y'all seeing any kind of evidence of cases coming out of Super Bowl parties at this point?
Well, Jerome, I'll take that a little bit, and if you want to add on, I would say as far as from Super Bowl, our experience so far has been that we're not seeing a direct correlation with any increase with people reporting having been at Super Bowl parties. I think that after the holiday travel, I think a lot of the community realized the risk that they had taken and saw the numbers going up everywhere, and they really did a better job of not traveling and not being in groups and masking and social distancing. And I think that's why we've seen the improvement. And I can't speak to yet what the increase means as far as specifically to the Winston-Salem area, if that's related to the Super Bowl or not. Jerome, do you have anything to add to that?
No, nothing to add, but just to support what you said, that after the holiday travels, the message got out that social distancing, masking is very important, and we're starting to see a slight downward trend in the aggregate across our communities. There may be certain areas that have certain spikes, but nothing that we can really speak to as relates to a trend just yet.
All right, thank you.
Next question is from Claire with WFAE.
Hi there. Thanks for doing this, and thanks for taking my question. It's Claire Donnelly with WFAE. I am wondering, or I have a question about variants. So could you talk about Novant's process for identifying the different coronavirus variants? How are you all watching for those? And are you submitting samples to the CDC? Could you just kind of elaborate a little bit on that?
Yeah, I'll start, and then Jerome, if you have any additional information, I'll try to channel my inner David Priest here. Dr. David Priest is not with us today, and he's definitely our COVID-19 variant expert, amongst other things. I've heard him say before, really our process with our LabCorp partners is that they send a certain number of samples to CDC to monitor for variants and that sort of thing. We don't do that locally in our labs within our hospitals or our physician offices. We depend on LabCorp to work with CDC on that, and I don't have any specific information on what variants that we're seeing in this area.
Thanks, Nick. Yeah, I really have nothing else to add. You pretty much covered it.
Next question is from Grace Holland with WFMY. Was I also on mute? Grace, are you there?
Hey, sorry, Samantha, I'm here. I was having a little trouble finding my mute button. Hello, thank you for taking my question. I also wanted to ask about the vaccination efforts up in the Triad area. How many of those 11,000 doses that Novant is getting will go to Forsyth Medical Center? And then I am also curious about this partnership Forsyth County announced yesterday between the Forsyth County Health Department, Wake Forest Baptist, and Novant Health to help increase vaccinations in the minority populations in this area. What exactly is Novant's role going to be in all of that?
That's a great question. So specifically in the Triad is really in every every county in the markets that Novant Health serves. Leaders from Novant meet weekly with the health departments and our other large entities like Wake and Atrium, just to make sure that we are on the same page and helping partner, not putting events in close proximity as possible, and just making sure we have the biggest reach of the communities that we serve as possible. So specifically, on the 11,000 doses, I don't have an exact number that will go to Winston, but we do have our larger vaccination site secured there at the Haynes Mall location in what used to be the Sears building there. And we can see a lot of volume through there. So we will send enough there to continue to see, around 700 a day at that location. Additionally, this week we've had conversations about a partnership with Winston-Salem State for the coming week to target their folks that are over 65 and then the surrounding community. And as you know, we just got done with Paisley Middle School's event 2 days ago when we were able to vaccinate over 450 community members in that historically Black community. So we're just continuing to keep each other abreast of our efforts and make sure that we work hard to meet our marginalized communities where they are. We had a planning meeting with Forsyth County today, and we will know more in the coming week on what that partnership looks like with Wake and Novant. I don't have an answer for the specifics on that, but we are all in this together to get vaccinations in as many arms as possible. So good partnerships there.
Next question is from Robin with Fox 46.
Good afternoon. Thank you so much for taking my questions. This is Robin with Fox 46. Just wondering, for the Spectrum Center event tomorrow, are you guys going to be requiring IDs? I know it is the 65 and older, and IDs when you guys start doing the clinics that are teachers only, will you require, proof of like a CMS ID or something like that? And also just wondering specifically on the Spectrum Center, how did you guys work with CMS? Was it, we have this list of teachers who are over 65 and, if you can work to get them scheduled, or how exactly did that partnership work on this one?
So go ahead, Jerome.
Yeah, so first and foremost, the appointments for tomorrow are scheduled in advance. And so we don't require, someone to show an ID because the appointment's already been made. Now, how did we identify those individuals? We worked with our CMS partners to identify those that work for and at CMS that are 65 and older. And then we contacted them via a number of means, some via phone, some through a sign-up process technology that we have deployed. But that partnership is key so that those individuals who are appropriate, those 65 and older and employed by CMS, are identified.
Yeah, and one more thing, Jerome, I'll add on to that. As far as we go forward, again, that's why it's really important that we have ongoing conversations with the health departments and other health systems in our markets that we serve, because we really, we want to stay in lockstep and not make it confusing for the public. So we don't plan to, as Group 3 opens up to essential workers, it's really going to be on a basis of attestation, and we're just appealing to the community to be honest with us and just think about it. If you were in line, if you were in a long line and there was somebody older than you certainly wouldn't elbow them out of the way to get to the front of the line. So thinking about it from that perspective, as you attest to what your role is in daycare or as a teacher and other things, that you're really, really being honest. We feel like requiring some sort of, paperwork from a job or a badge or other things will really just be a barrier for people in the community to get vaccinated. And at the end of the day, that's not what we're trying to do, is put up barriers for patients to get vaccines in arms.
And the actual hope is that once allocation increases and vaccines become much more available, that becomes a moot point.
Exactly.
Next question is from WCNC.
Hi, this is Chloe with WCNC. Superintendent Winston, I was wondering if you could share maybe what some of the teachers' reactions have been to being able to secure an appointment, since it has been tough to get one in groups 1 and 2 even? Thank you.
Yes, thank you for that question. I appreciate that, and we're going to share definitely more about that momentarily, probably within the next half hour. But I would say that teachers are excited to have an opportunity to be able to have access to the vaccine. Certainly, as you've heard from public health experts locally across the country, the vaccine is important. And there's more and more education taking place daily to help people understand the importance of not only their personal health, but the health of their family members and loved ones in terms of getting the vaccine. So more to come on that later, but great question.
We have a follow-up question from Tina.
Thank you for taking my follow-up question. I did want to ask if you can tell us if you already have plans to conduct another large vaccination event at the Spectrum Center, or is that something that will be decided and discussed after watching tomorrow's event and how it goes? My second question, can you elaborate on how Novant Health patients were selected for tomorrow's event? Thank you.
Sure, great questions. First, I would say that the second dose for the group that we'll see tomorrow is already planned. And so that will be at the Spectrum Center, and we're constantly evaluating how these things are going, the cost involved, what community did it reach to make decisions on what future events might look like. We are looking to open a larger vaccination site in the Charlotte market. And so we'll have to consider, is it a better strategy to continue the smaller, church partnership, school partnership events, and in tandem having a larger mass site like we have in Winston here? Or is it a better strategy to have these large events like we're able to do tomorrow at the Spectrum Center? So it could be both. And then as far as how do we select patients, it's an ongoing work. We several weeks ago put out for anybody in the community to go to getvaccinated.org. That's a Novant Health site, and they can plug in, figure out what group that they fall into, and if they were in groups that we were vaccinating now, they could go ahead and have access to our appointments. If there wasn't an appointment in there, they could continue to check back. And so specifically for this event tomorrow, we held a certain number of those appointments back, and we sent them in a more manual process to CMS to make sure that the teachers who were 65 and older had access, and then other community partners, and Jerome can speak to that more. And then after we let that run up until yesterday morning, really, we opened up the appointments that were left to the general community that's checking back often to take up the rest of the appointments. So we made sure we didn't have any appointments left on the table, so to speak.
And the only other thing I would add, Nikki, would be our mobile units. We're deploying our mobile units in certain areas throughout the community. And the hope is that with the eventual approval of the Johnson & Johnson vaccine, which is a one shot or one dose of vaccine, we can leverage our mobile units even more to areas such as rural areas, such as those that are sick and shut in and can't leave their homes, for those in communities that are in certain public housing. So as Nikki mentioned, it's an ongoing evaluation of our strategy and tactics, also based on vaccine allocation.
The final question is from Caroline.
Hi. Last week at the Park Expo, you guys did about 3,500 doses, and then tomorrow at Spectrum, you're just doing 2,200. Why are you doing fewer at this venue? Is it just because you have other events going on as well and not a lot of vaccine, or?
Yeah, so that's always based on that allocation, and we had enough to be able to do. We actually did a little over 4,000 at the expo, but this week we had some, we didn't get as high of an allocation, but also we had some other events planned, and so that left about 2,200 for Spectrum.
And then once we do move into the next group of vaccinating teachers, does Novant have plans to start vaccinating some of those younger teachers? Like, would there be a specific teachers kind of clinic?
Yeah, so we're working on plans for that. I mean, as you know, our 65 and older appointments are well out into April and May. And so we want to give them an opportunity to perhaps schedule a little bit earlier, but we will be adding in appointments for teachers too that are under 65 as we just work through teachers and daycare workers and just look to that allocation to be increased, because as the allocation increases, we will increase appointments for everyone who's in scope from the state to be vaccinated.
All right. Thank you for your time today, everybody. There is that 2:30 briefing at Spectrum Center about tomorrow's event. Just as a reminder for more in-depth questions with Superintendent Winston and others. And we will have the next briefing on Tuesday at 9:30 a.m. Thank you.
Thank you, guys.
Have a great